In response to the worsening trends and existing challenges for our healthcare system, I'm strongly recommending that all Ontarians, not just those at high risk, wear a mask in indoor public settings, especially around our most vulnerable Ontarians, the very young and the very old.
Ontario isn't the only province making this recommendation. Quebec's College of Physicians is recommending people wear masks in public places, crowded private spaces, and on public transit. Dr. Kieran Moore says what might be a cold to an adult can lead to a severe respiratory infection in a child 4 and under.
Unusually high numbers of children are coming into hospital emergency departments for one or more of these viral illnesses, and the total number of these children that require admission is uncommonly high. While our hospitals have been preparing for this triple threat, we, along with much of North America and many places around the world, are seeing high numbers of these seriously ill children and seeing them earlier in the season than had been expected.
Health officials say all hospitals have implemented surge plans to increase bed capacity and redeploy staff to help deal with what officials call an extreme surge in pediatric patients.
I spoke to Dr. Cohen, the CEO of Hospital for Sick Children, yesterday, and I'm very sorry to say that half the children in the intensive care unit ventilated right now have RSV and half have influenza. Those two can be diminished by masking around our most vulnerable, our children, in our home situations, in our social situations. Yes, masking at a population level will help, but we really need to focus where we can protect our children, who are the ones under 5 getting admitted to hospitals as we speak.
But Dr. Kieran Moore stopped short of reinstating mask mandates this morning, although he says he's reviewing the possibility of bringing them back in schools.
We're learning from Quebec, learning across North America on how best to care for our children and build capacity across the system. If that capacity is threatened, that is when we'll be advising further to government. At present, we're at 100%, and the call is across Ontario to protect our children and most vulnerable.